Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. I have for you today a couple of cases of patients who attended with severe otalgia. So otalgia is the medical name given for earache or ear pain. And of course, when a patient attends with earache, it just makes the procedure a lot more difficult because inevitably by entering the ear with a couple of instruments like we are, it's going to unfortunately add to that discomfort that they're experiencing until we get the wax out. So it's always a lot more difficult, a lot more challenging. You have to be on edge a bit more. You have to be ready to suddenly remove the instruments from the ear if the patient makes sudden head movements. We've got to make sure we've got a good brace. So I'm holding the endoscope, the iClearscope endoscope in my left hand, and as I am, my middle finger is extended and it's making contact with the patient's bottom part of the ear, so underneath the lobule, and we call that a brace. So if the patient suddenly moves, I've got my finger there to prevent the patient coming towards me and the instruments. We had to take a couple of intervals here because the patient felt a bit faint, purely because of the pain they were experiencing. And as I was removing this, I think it was, you'll see a sudden movement in a moment, and as this wax is coming away, the patient can feel that movement of the wax coming out of the ear, but at the same time it's very painful for them, and that suggests that this is really impacted. The patient did advise that they had used not cotton buds, but they do wear swim plugs, and also they had a failed attempt of their ears being cleaned the day prior. So it's possible that when they had their ears attempted to be cleaned the day before, that may have made it slightly worse. They advised that they had ear irrigation. Now, ear irrigation is when earwax is attempted to be removed by flushing water into the ear. The concept is the water fills up the space behind the wax plug up against the eardrum, and as it fills up, the water will inevitably then have to drain out of the ear, and as it drains out of the ear, it flushes away any wax. But if you've got a completely blocked ear like this and there's no opening for the water to get in and behind the wax, it can potentially jet wash the wax further into the ear up against the eardrum. And once I remove this, you'll just see how sore the patient's ear is. I've just put a lot more olive oil to help lubricate this wax plug, so there's less friction as we're bringing it, because that's what's making the patient flinch. And you can, I don't know if you can tell, you probably can, I'm being really tentative with that sucker. I'm half ready to withdraw that suction probe. There we are. So I could sense the patient was going to experience some discomfort there and suddenly movement. And as they did, I was just ready to withdraw the suction probe. At this stage, the patient could hear significantly better, and they did become a bit faint, I think, as well, if memory serves me correct. And they were just overawed by having their ears, all this wax being cleaned. And so we just took a little break, and you can see posteriorly the ear is really sore, it's quite bruised. It will settle. Recommended some acetic acid spray just to help calm the ear. It doesn't look infected, it's not inflamed. The ear canal itself is not inflamed, should I say, but yeah, there's a bit of bruising there posteriorly. I just went back in to see if I can hover this up, but I decided just to leave it because it was just staining, and patients were in discomfort, and trying to remove that, potentially making contact with the canal wall, it's not going to do the patient any favours. So I'm happy, the patient was happy. Just advise them to avoid getting any water in the ear. They are a keen swimmer, and I was just concerned that, and they do take precautions, as I said, they wear swim plugs, but I'm just a bit concerned that the water does get into the ear because the eardrum is slightly inflamed. We don't want it to trigger any infection. So this is patient 2, this is their right ear. That's quite clear, but this is the problem ear. So give you case history. This patient's been suffering for a couple of weeks, and again, the onset of their symptoms was getting water in the ear. There is a trend here. Water in the ear, they admitted to using a cotton bud, and this was far more severely impacted than patient 1, and you'll just see how sore and bruised this eardrum is once I remove this wax. And they too did have their ears irrigated, or attempted to have it irrigated the day before. They actually managed to book in with their GP practice to have the procedure done, which is very unusual in the UK. Prior to COVID, you were able to have your ears de-waxed at your GP practice, so we call that primary care, and the method used was ear irrigations, which I described earlier. There was, before COVID, there was many primary care providers that were beginning to withdraw offering earwax removal as a service on the NHS, and they would instead advise patients to DIY self-syringe, which is not something I endorse, or make onward referral to ENT at the hospital, which could be a significant waiting list. And then COVID happened, and post-COVID, more or less, I would say 90% of surgeries that, at least in my local vicinity and area, no longer offering any ear care services, but this particular patient GP practice still do, and which I don't think is a bad thing. Now, do I endorse irrigation? Is it a technique I use myself? No, and the reason for that, it's a blind technique. You're using water, and by using water, there's always a chance of developing an ear infection. If the patient's got underlying perforation or T-tube, grommet, a ventilation tube, you're not able to perform ear irrigation. Like patient 1, it can, and this patient also, if not performed, not even if it's not performed correctly, because that implies the specialist performing it is doing it incorrectly, but even if they're doing it correctly, if there's no opening and there's a complete seal, it can just embed the wax further in. Water can wash away all the natural oils in the ear and the acidity, which can then give rise to fungal or bacterial infection. And of course, fungus and bacteria, they love warm, damp, moist conditions. So now, I know a lot of people do use irrigation in the UK, so I'm not saying they're doing anything wrong, but it's just a technique that I don't favour. Although I've been trained in irrigation, all my procedures are performed using microsuction or with mechanical instrumentation. So I still do, though, believe there should be a service offered in the primary care by GPs and other primary caregivers. Now, I know there's a lot of lack of resources and funding provided to the GPs to do it. So, again, their hands are somewhat twisted behind their back. So there's a bit of a dire situation, because having ear irrigation performed is better than not having your earwax removed. Of course, there is side effects with irrigation. There's more prevalent risk of developing, as I mentioned, ear infection or tinnitus. Patients who are diabetic, elderly, immunocompromised, you've got to be a bit more wary with performing irrigation, because there is some evidence and research to suggest it can give rise, it's albeit rare, to a very dangerous condition called necrotizing or malignant otitis externa, which I had a case of earlier in the year. So you've got to be well rehearsed and drilled, and ensure you perform it in the right clients if you are going to perform it. But having that option for some patients in the NHS, I think it's necessary. So unfortunately at the moment, if you're a patient in the UK suffering from earwax, the likelihood is that you're going to be either told to flush this wax out yourself, and by going online to get a DIY home syringe kit, or going privately. Having done it privately obviously is a cost. Growing up, I wasn't really well off. Would I be able to afford having my ears cleaned? No. So it is a tough situation. I hope something can be some provisions can be made back in the NHS. I know there's a lot of work going behind the scenes, a lot of lobbying, and a lot of MPs are getting contacted by their constituents to raise this as a matter to be discussed in the House of Commons. And if I can assist in any way, I'm more than happy to, because I think earwax removal is or earwax impaction is just seen as a taboo subject, and it's not. It can really affect people's day-to-day life. Anyway, that's probably for another day. I've removed all this. You can just see how sore that ear was. You can see I used an ear hook. I was just mopped up near the entrance. I just didn't want to. The patient was in agony. They were very grateful, but they were in agony. And in the UK, as an audiologist, I can't prescribe, unfortunately, any local anaesthetic to perform the procedure. So all my patients are treated without any anaesthesia at all. So I'm just mopping up there. Well, I hope you enjoyed that video, guys, and it was an interesting couple of cases. Do take care, keep well, and speak soon. Bye.